One of the most important things that we can do for our patients prior to considering a shoulder replacement is really focus on making sure our patients understand the appropriate expectations and outcomes that we're looking to achieve with a surgery, and have a good expectation about what the recovery process looks like. To that end, I spend a considerable amount of time in my office discussing with the patients what the intraoperative, post-operative hospital stay looks like, slings, when they're going to be able to return back to driving and to normal activity, so that we all are on the same page about what the process will look like, and how we're going to be able to pursue an excellent outcome at the end of the day. I try and send patients home with educational pamphlets that can help answer some of their questions even after the visit, and I'm always open to further discussion before moving forward with surgery. And I also encourage patients to reach out to friends and family members who've gone through similar procedures, as they may have a different perspective and raise good questions that will be helpful prior to moving forward with surgery. Specifically, some things that may come up after surgery that may be helpful to address in advance are sleep positioning, sometimes sleeping in a more upright position in a recliner, a wedge pillow, a bed that may fold up a little bit may help them with post-operative pain control and their ability to get some sleep. Obviously, we want to optimize nutrition and bone health just for implant stability and fixation and wound healing. And then something that I do to help them set themselves up for success is I often obtain CT scans on most of my patients so that we can preoperative plan the case itself. I can use it as an educational tool to show what the implants will look like and what the final prosthesis will entail, and go a step further in the setting of deformity or bone loss. I can even make a 3D printed guide that will help me intraoperatively in order to hook right onto the patient. It's very patient specific, allows me to optimize the positioning of the implant, decrease operative time, and ultimately allow them a more successful and long-term recovery with excellent outcomes.